Welcome to our in-depth exploration of somatic symptom disorder, a complex condition where physical symptoms and psychological distress intersect in profound ways. Over the next 10 minutes, we'll examine what this disorder truly entails, how it affects those who experience it, and the most effective approaches to treatment and management. Somatic symptom disorder represents a significant shift in how we understand the relationship between physical symptoms and psychological processes. Defined in the Diagnostic and Statistical Manual of Mental Disorders, DSM-5, this condition involves one or more physical symptoms that cause distress or significant disruption in daily life. These symptoms might include pain, fatigue, weakness, or various bodily complaints that may or may not be explained by another medical condition. What's crucial to understand is that regardless of whether an underlying medical explanation exists for these symptoms, the defining feature is the disproportionate and persistent thoughts, feelings, and behaviors associated with these symptoms. Individuals living with somatic symptom disorder experience physical sensations in a heightened, often alarming way. They may become excessively worried about normal bodily functions or minor physical sensations, interpreting them as signs of serious illness. This isn't simply being health conscious, it's a persistent pattern where physical symptoms dominate daily life, consuming excessive time and energy. The person might constantly think about their health concerns, repeatedly check their body for signs of illness, or seek frequent medical consultations. Alternatively, some individuals might avoid medical care altogether due to fear of what might be discovered. To illustrate this experience, consider Sarah, a 42-year-old teacher who developed persistent abdominal discomfort. Despite multiple medical evaluations finding no serious condition, Sarah became increasingly preoccupied with her symptoms. She researched gastrointestinal diseases extensively, frequently examined her abdomen for changes, and began restricting her diet dramatically. Her thoughts about potential serious illness consumed much of her day, affecting her work performance and social relationships. Sarah's case demonstrates how somatic symptom disorder isn't about imaginary symptoms. Her pain was real, but rather about the disproportionate response to those symptoms. The prevalence of somatic symptom disorder is significant, affecting approximately 5 to 7% of the general population. It occurs across the lifespan but often begins in early adulthood. Women are more frequently diagnosed than men, though this gender disparity may partially reflect sociocultural factors and healthcare-seeking behaviors rather than true prevalence differences. The condition tends to follow a chronic course with fluctuating severity, often worsening during periods of stress. What causes somatic symptom disorder? Research suggests a complex interplay of biological, psychological, and social factors. Biologically, individuals with this disorder often show heightened sensitivity to bodily sensations, a condition known as somatic amplification. Neuroscience research has revealed differences in how their brains process sensory information and bodily signals. Genetically, there appears to be some hereditary component, with the condition sometimes running in families. Psychological factors also play a crucial role. Many individuals with somatic symptom disorder have difficulty identifying and expressing emotions verbally, a trait called alexithymia, which may lead to experiencing emotional distress as physical symptoms instead. Certain thinking patterns contribute as well, including catastrophic interpretations of bodily sensations, hypervigilance to physical symptoms, and difficulty tolerating uncertainty about one's health. Early life experiences significantly influence the development of this condition. Childhood trauma, neglect, or witnessing illness in family members can shape how an individual perceives and responds to physical sensations later in life. In some cases, receiving attention or care primarily when physically ill during childhood may unconsciously reinforce illness behaviors in adulthood. Social and cultural factors cannot be overlooked. Different cultures have varying approaches to expressing distress, with some emphasizing somatic expressions over emotional ones. Additionally, family dynamics often play a role in maintaining these conditions, with well-meaning family members sometimes inadvertently reinforcing illness behaviors through excessive attention and care. Diagnosing somatic symptom disorder requires careful, compassionate assessment by healthcare professionals. According to DSM 5 criteria. Diagnosis includes one or more distressing or disruptive somatic symptoms, plus excessive thoughts, feelings, or behaviors related to these symptoms, persisting for at least 6 months. Importantly, diagnosis isn't about determining whether symptoms are real or imagined. All symptoms are acknowledged as genuinely experienced. Instead, the focus is on how the person responds to these symptoms and the impact on their functioning. The diagnostic process typically involves comprehensive medical evaluation to assess for underlying medical conditions, followed by psychological assessment. Clinicians must approach this process with sensitivity, as patients often feel dismissed or accused of making up symptoms when psychological factors are discussed. It's essential to validate the reality of their physical experience while exploring psychological components. Treatment for somatic symptom disorder is most effective when it adopts an integrated biopsychosocial approach. Cognitive behavioral therapy, CBT, has demonstrated particular effectiveness. CBT helps individuals identify and challenge catastrophic thoughts about physical sensations, reduce checking behaviors, and gradually increase activities despite symptoms. For example, someone constantly checking their pulse might learn to recognize this as an anxiety-maintaining behavior and practice refraining from checking while tolerating the temporary increase in anxiety. Mindfulness-based approaches have also shown promise, helping individuals observe bodily sensations without becoming caught in cycles of catastrophic interpretation. By learning to experience physical sensations with curiosity rather than fear, patients can reduce the emotional reactivity that often amplifies physical discomfort. Psychodynamic therapy can be valuable for exploring underlying emotional conflicts and early life experiences that may contribute to the condition. For some individuals, unresolved grief, trauma, or relationship difficulties may manifest partly through physical symptoms, and addressing these underlying issues can provide relief. Medication may play a supporting role in treatment, particularly when comorbid conditions like depression or anxiety are present. Antidepressants, particularly selective serotonin reuptake inhibitors, SSRIs, may help reduce symptom preoccupation and improve overall functioning. However, medication alone is rarely sufficient without psychological interventions. Perhaps most crucial is the establishment of a supportive, consistent relationship with healthcare providers. Regular scheduled appointments with the same provider, rather than emergency visits or doctor shopping, create a foundation for improvement. The most effective approach validates the reality of physical symptoms while gradually shifting focus from symptom elimination to improved functioning and quality of life despite symptoms.